Welcome back to Bloom. Just the thought of invasive back surgery is unnerving. But now there's a new option, a minimally invasive technique created by the neurosurgeon who is transforming spinal surgery with this revolutionary procedure. Joining us to discuss this minimally invasive spinal fusions for back pain is neurosurgeon Dr. Hamid Abbasi. Welcome back to Bloom, doctor.
Well, thank you for having me back.
Well, it's great to talk to you because this really affects so many people. Dr. Abbasi, can you explain why your back surgery technique is so unique? Because I understand that you operate in a minimally invasive way.
Let me just use the words of my patient. Just 4 minutes ago, just in the other room, I saw a patient that I did that surgery about 3 weeks ago. And this patient just told me that he has a neighbor and a friend who got an open old-fashioned surgery. Months later, they are still miserable. Their surgery was 7 hours. They stayed in the hospital 7 days, and their pain is still excruciating after months of recovery. Whereas he just told me, and I'm going to put his testimonial online, that his life is changed. And he's able to do everything he couldn't do before. And this was with a surgery that was 45 minutes, and we had the 20 cc of blood loss, and he stayed in the hospital only just 1 night. And the whole magic in that is that we don't cause lots of collateral damage to get the surgery done. And we do it through a tube that is barely bigger than a pencil.
And I know one of your biggest goals is to help people who are often told that they can't have traditional surgery. For example, one of your recent patients flew across the country to see you because he was told by other surgeons that he was just too heavy to survive. How were you able to help him?
Now, we have to understand that we as surgeons are extremely trained to do a risk versus benefit analysis. And now it just happened to be that if patient comes with some comorbidities like people who are elderly or who are much heavier, we have to do much more work. And much more work for a surgeon means much more cutting, much more blood loss, more risk of infection. Like this patient who flew to us, he has been rightfully told that the surgery could be deadly for him because when you are 500 pounds and you're laying on your lungs for 8 hours, 10 hours, 12 hours, it's very hard to recover from that. Our magic is that because we don't have to do cutting of the muscle and the bone, we can do that surgery under 2 hours. And he was discharged from the hospital 2 days later, whereas he was told he would die rightfully. He was told he would die of open old-fashioned surgery.
That is incredible that you were able to help this man. You mentioned obesity and older age, or that's common reasons that people are turned away, but you just operated on a 92-year-old nun.
Yeah, and that as well, you know, many of these surgeries, open old-fashioned surgeries, can be done safely in younger patients, but we know that when we get older, our spine is more likely to fail. And as a matter of fact, we call it degenerative disc disease, practically age-related disc disease. So these problems are more common in elderly than in younger people now. And that's exactly the situation where as well our heart, lung, kidneys, or the rest of our bodies as well old, and can take less of a risk, less of a injury that any surgery could cause. And that is where we come in. We use less resources of the body. So we make an impossible surgery in this marginalized group of patients that we can provide that surgery so much safer, where open surgery practically the risk versus benefit is not justified.
Well, I have to tell you, I know that people fly across the country to visit you because they're turned away by other surgeons, to the point that now you're trying to train others to have the gift that you have. We really appreciate you sharing what you do with us, Doctor, here on Bloom.
Thank you very much for having me.
And for more information, you can visit the doctor's website at inspiredspine.com.